Guys, we're in the middle of a pandemic and these are trying times. It's hard on our mental health, our mental state. And this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees.
COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. All right, Quadcast Nation, we have one of our returning guests. I can't even keep track of how many appearances. Michelle Sorensen, psychologist, clinical psychologist, solving wellness enthusiast. Welcome back to the show.
Thank you. Always a pleasure.
Absolutely. Great to see you. And before that, I should give a little preamble about solving wellness people. This is our way of addressing burnout within healthcare. You know, we've seen how many are burned out, and this is a way of dealing with this in the best way we know how, on a virtual format where you have access to workouts, yoga, stress management, cooking classes, nutrition tips, productivity tips, and it's all under one roof. We're up to about 200 members and growing. So sign up, solvingwellness.com. You won't regret it. All right, Michelle, we asked you to come back because of what I've personally been seeing, not only on social media, but also, you know, front lines where people seem to really be not only burned out, but having that compassion fatigue. They're just, you know, especially when it comes to seeing patients that have COVID, those that are unvaccinated, there's just this real, you know, there's not the same level of compassion or empathy that was, you know, a time ago. And so I thought we would just discuss like how best to address this, you know, amongst us so that we can better serve our patients.
It's a great topic, I think. And I've definitely, you know, I am in healthcare as well. And also I work with a lot of clients who are in healthcare and really value that part of our community. But I mean, I think we just have to start with self-compassion for ourselves in healthcare to say that, you know, this really, like, it's just such an extraordinary situation, this whole, I mean, it'll be 2 years, feels like, before we know it. So like just to stop for a minute and think about what so many parts of healthcare, especially the frontline hospital settings and pharmacies and places where people really had to put themselves out there when we didn't know for sure who the at-risk groups were and, you know, all those like kind of layers of worries. But then even just stepping back and looking at healthcare at large, I mean, just for the level of stress within the healthcare system and for patients and separated from family members, but then every individual who's doing that work has their own pandemic stresses, right? Their kids are out of school, or maybe even loved ones who were sick. There's just, I think when you look at the amount of suffering everywhere, everyone's got their tipping point, and no wonder people at various points are like just kind of reaching a time where they don't feel like they have as much to give. But I do think it's important to talk about it because I think for healers and helpers, that's actually so disconcerting when you're not yourself that way, when you normally really feel compassionate, right?
Yeah, these are really good points actually about the self-compassion piece, because there is the stuff you need to address, or the stuff that you've seen at the hospital. But then, as you said, there was stressors at home. Like I could think of a few of our staff that had loved ones in long-term care. Mm-hmm. Obviously, a lot of us had dealt with the school scenarios, maybe had some COVID scares within the families. Like there's so many added pressures when it came to this whole pandemic. And it's a really good point that there needs to be highlighted, that, even there were stresses outside. Like there was even that much more need to have that a level of self-compassion.
Mm-hmm. Absolutely. I mean, I remember it was around this time last year that I went to a few funerals for parents of friends of mine. And, both those friends were not frontline healthcare, but working with parts of the government where it was just flat out all the time, like Zoom calls on weekends or long hours. And that's a good example, right? Like they have these huge personal losses of their own, but you got to keep going, or maybe they take a little time off and contributing. So yeah, it's so true. There's just, the normal suffering in life that we can't get away from, like being alive means we encounter trauma. That normal trauma has continued, but then with just these extraordinary circumstances, the loss of structure, again, of like school and going to work, like everything kind of upside down.
Yeah, routine. So, your routines. It was almost as hard to remember what pre-COVID routines were at some points during the pandemic. Yeah. Luckily, we're close to that now. But wow, these are the very good points, Michelle. So
just the loss of community, right? Like I think when you look, a lot of people in healthcare are people who like connection, and they need that sense of community. And even for all of you in your work settings that are masked all the time, like all of it does. I understand it's been important, but it gets in the way of things like smiling at each other and things that help people's mental health, right? So, yeah,
no, it's true that community. It's such an important part of wellness. Like we were at a hockey tournament this weekend, and I literally, when we were all together cheering on our team, I did get a little bit weepy-eyed, because it was like, this hasn't happened for so long, and the boys have missed this opportunity. Like these are memories that you'll never forget. Having that many people cheering your every shot, goal, save, and it just made me really it made you cherish the moment, but also more in the fact that this was lacking for so long for us and our kids.
Yeah, it's huge. I think if you look at our workforce, a lot of healthcare workers who are at the prime of their career, like in leadership positions, like in a position to really make an impact, it's also the busiest years, right? They have aging parents, or as we said, like losses in your family of young kids to raise. And so, when you look at that incredible amount of pressure, or for young colleagues who need mentorship and learning, and they're just like in the fire right away, and everyone's so stressed.
Mm-hmm. Yeah, it's not. Yeah, it's fair. It's not the same when there's less bandwidth for mentorship and fostering when you're in a time of crisis, right? Mm-hmm. Very good points. So you're going to say something?
Well, I was just thinking that, let's start for people listening who are in healthcare or another stressful sector like education, or, places where just the demands feel overwhelming. I think, starting with that self-compassion, and then just kind of like the neuroscientific understanding that like we all have our breaking point, right? So even if, people in healthcare often are nurturing people who, people in other sectors might be like, oh my God, people have said this to me. I don't know how you listen to people's problems all day. Well, we're all wired different. Like, I love that. It makes me feel good to do my work. Whereas I would look at an accountant or engineer and be like, oh my God, how do they do that all day? But they love it. But anyways, just the nature of healthcare people and teachers and people who love helping is that for them to feel a disconnect, like they don't have compassion left, or for other healthcare workers to see it in their friends, like to hear, I don't know, maybe them speaking in a way they wouldn't normally about patients, or, sure, everyone always vents, but maybe different behaviors coming out. I mean, that can be a little bit traumatizing in itself. So I think it's important to just start with trying to forgive ourselves if we're at that point, or forgiving others that, these are extraordinary circumstances.
Mm-hmm. So number one, forgiving ourselves, really having that understanding, like these are extraordinary circumstances, because they really, as we mentioned, these are truly
crazy.
Yeah. Like we've gone through other crises. I don't know the crises.
Yeah.
I don't know the plural of crisis before, but obviously nothing like this. So
that's right.
So you take those steps. Is there anything else that we could be doing to kind of get us into a more compassionate state?
Well, so I think it's different for everyone. I can kind of reflect on some of the things I see being helpful for people, but maybe again, that's where like the self-compassion and just the self-appreciation needs to start. So say someone has actually really powered through the last year and a half, and then all of a sudden they're hitting a breaking point now, or they hit a breaking point in, May or June. Like, especially for people now, I think they might be like, why now? Like the fourth wave hasn't turned out to be so bad. The third wave was the heaviest. Well, there's no right or wrong time. And again, like if people can try and just be accepting, like, this is the way it is. This is what I'm going through now. Can I, in the face of that suffering, recognize that something needs to shift, that I need to take care of myself? And I think that the way people do that, whatever works for people, is great, right? Like I saw something the other day on online where someone was talking about like, oh, don't pretend yoga is therapy. Like it's not a clinical, there are methods like CBT or EFT that work. And I was like, no, I don't think I agree with that. Like not to, criticize that person, but like, I'm all for whatever works for you. Maybe one healthcare worker starts going to one yoga class a week and they learn to breathe and they get more in touch with their body. And then they find themselves like at first, I remember years ago, I was like this with yoga. I was like eager to get out of the class at the end. And then you start noticing you stay in Shavasana longer and you're meditating a bit. Before you know it, maybe you're meditating a little bit in the mornings. Like whatever journey people have to feeling better is great. Last spring, I was starting to burn out a little bit and I got a puppy and it's amazing. It's the best therapy I could ask for. Like it worked for me,
Yeah, I like this. It's like find your, lack of a better word, your huckleberry. What's going to get you back to where you need to be? Because, the more I think about it, there's so many of us they're leaving the profession actually. Like those have been one of my sites
early or reducing, right? People who a full-time nurse, it's like, I'm just going to work part-time. And I know people have to take care of themselves. Now that's often, yes, it may be compassion fatigue, but it's sort of like the stressful work environment can lead to complete burnout, right? And in the hospitals, I think for sure we're seeing this. Whereas the compassion fatigue, if we catch it early, we don't have to get to total burnout, right?
Right.
But this is a great reason to work on it so we don't lose people.
And I can't remember if we said this. Yeah, I think it was before we started, but that's an early sign. That typically would be an early sign of burnout, right? Where you're starting to like be, your compassion starts to fizzle away a little bit. Like that's another important point, actually, that if you're noticing that in yourself or your colleagues are noticing it in you, that's a flag, yo. That's a signal that we got to maybe rethink things.
Yeah, for sure. I mean, it's no wonder that people are burning out, but I really do believe there are tools that people can use to help prevent that. So one thing that's kind of interesting that I've seen articles on over recent years is sometimes people get into this, I guess, in psychology circles or mental health circles, looking at the difference between empathy and compassion. So empathy is really putting yourself in someone else's shoes, trying to understand their sort of experience. And compassion is like facing and seeing suffering and, sort of being there, like trying to observe and provide some comfort to suffering. And I think that's kind of I'm not sure. I mean, maybe it's splitting hairs, like the two overlap a lot, but maybe that's something that might resonate for some people that are feeling some compassion fatigue. Is that if you find yourself too much trying to figure out other people or trying to put yourself in their shoes, and then that stays with you and you're thinking about them later after work, we don't have to honor all losses in patients by taking them home with us. Like you can be a very compassionate, caring healthcare or helping professional, and you can do your job and be there in the moment, and then you can let it go. Right. And I wonder, too, some of the anger we're seeing in society these days really comes from everyone kind of trying to control how other people feel and think. And in a way, I don't know if that's that empathy thing, or if it's somewhat related. So, for example, in my office, I see people with all kinds of different beliefs and experiences of COVID. And if I was experiencing compassion fatigue and I was really burnt out, maybe I was too busy and not using my tools right, then I could easily get frustrated by people who think differently than me, right? Or, some people last year, like you and I, felt it was very important that kids were in school. And some people actually felt very differently, there are people who still have their kids at home and don't send them. But if I want to feel compassion for people at all ends of the spectrum, it's to really let go of the need to, there's nothing to fix there, we just kind of provide space, we provide compassion, and we can kind of just let that part go, if that makes sense. It's a bit hard to put into words.
Yeah, I think what I'm hearing is we don't need to convert or don't need to, maybe convert's the wrong word. Maybe we don't need to, I guess what I'm hearing is you don't need to invest so much. Basically.
That's perfect way of putting it. That's what I would suggest to people who are feeling like they're at their tipping point. They don't feel quite like themselves. It could be physically that they're on edge, agitated, like their nervous system, alarm bells are on. But it could be too through their communication. They see signs of it. I think, that's it. Don't invest so much. I know you always say we're here to serve, but maybe people taking a little bit of pressure off themselves about trying to fix it all, right?
Yeah, no, I'll say personally, this has been a salvation for me, straight up, realizing that you can't fix everything. You can't be involved in everything.
Yeah.
You got to pick your battles. There's only so much emotional bandwidth. Oh my God, when, in the heights of all of this, whether it was schools, whether it was inequalities, whether it's people, treating people inappropriately based on their vaccine status, there's so many battles, but you really just gotta, you can't be invested in all of them. Otherwise you will burn out. You will, exhaust that compassion side of things. So
and people don't like being told what to do, right? This is common. We see it with kids, but it's so true for adults too. And this is a big part of the motivational interviewing style, which has been very successful across healthcare, people with addictions, the Heart Institute has used it for smoking cessation. I worked with that group when I was at the Heart Institute. The idea with motivational interviewing is that you roll with resistance. You kind of hold back on what we call your righting reflex. Lots of us in healthcare, we want to make things right. That's our drive. And probably, you could do a lot of psychoanalysis on how that started in a lot of people. But it's a really like kind of misguided instinct that a lot of, again, helping professionals and healers have, like, oh, if I just tell them this, and this, then it'll be better. But sometimes like just plant seeds, just give a little information. You don't have to get an answer out of people. Like often if you see them later, you'll find out it had an impact. But I think that really non-aggressive, just, share a little information, show compassion, reflect back what someone says and show that you're trying to understand their perspective, right?
Yeah. Well, we know this is effective. Like the motivational interview style, like there was the rollout of a program in Quebec to enhance child vaccinations. And the results were impressive. Actually, I tried to get the guy that started the program on the show. I'll find you. But no, and then I was reading about this on Adam Grant's book. What's it? Oh, it's such a good book. Rethink? No, it's something. Think Again.
Yeah.
Everyone needs to read that, by the way. We'll put links in the show notes. It's a game changer. But yeah, exactly. Like it's just having that perspective of, I'm not going to change your mind right now based on my factual approach. I'm going to have that empathetic, compassionate lens, listen and show that I'm listening, and then just have a discussion about some of these things. And legit a successful evidence-based way to help people see the advantages of different interventions. So
yeah, it's really recognizing that change happens in stages, right? That there's pre-contemplation, contemplation, preparation. Like you're not just, it's not just like a 2-second process where all of a sudden people are like, oh, I'm going to quit smoking. Oh, I'm going to get the vaccine. Oh, I'm going to lose weight. Like people need time to make change.
Time and also like trust. They want to be able to know that, you care and that you're listening.
Yeah.
It's not to go too much off a tangent, but like, it's like the foundation of healthcare. It's the foundation of public health. All of that is on trust. So, sometimes I think we're forgetting about that. You know what I mean?
Yeah, no, I mean, there's been research, right, that has shown like a little bit of extra time, like you don't cut a patient off. Like in doctors' offices, this unfortunately happens a lot, right? That patients are interrupted. And there's been research done that shows that if you let them finish talking, they're not going to usually go into a half-hour tangent. And that if doctors are more empathic, and other healthcare too, that actually you're more likely to get results. I always remember this one book I read and because I have diabetes and I work in the diabetes field, I found it fascinating. It wasn't a book about diabetes, but this doctor happened to cite research that, and I don't know the details of the study, but it showed that patients with diabetes that had a high empathy doctor had a 40% lower incidence of complications long-term. And it was just, and again, without remembering all the details of how the study was done, because that is important, but just amazing. Like if a medication came out that reduced diabetes complications that are a huge tax on our healthcare system, and it's actually empathy, right? But it can be hard sometimes in healthcare.
But it can be, but to be honest with you, we see it all the time. That better communication leads to better results, leads to a better patient experience. Patients are more motivated. Everything gets better when there is that empathetic, compassionate stand. And
totally. I'll just share one quick story from many years ago when I first came to Ottawa and was working with a lot of young adults with type 1 diabetes. So the diabetes teams will often, when they're a bit stuck with the case, refer for adjunct support. And this young woman was very dedicated to working with me and her team, but so not ready for change on a very outdated insulin approach, like not multiple injections. Anyways, eventually, she moved through different stages, overcame fears, and her team was thrilled. She even went on the insulin pump and updated technology. And I remember her telling me saying, wow, how did you do this? Like, what made the difference? And she said the biggest thing was her diabetes educator or her doctor, well, kind of both, saying, we will give you our pager number whenever you need us. We're available. Like, we're here for you. I guess that was her educator. And the doctor was like, I'll meet with you every week if you need me to. This is unheard of in diabetes care, right? And she didn't use either of those options, but she said that warmth and compassion, like feeling like they actually really cared, that was what made the difference, you know?
Absolutely. I love that story.
And literally life-saving. Like, I've worked with young women like that are headed, like they are not going to live a long, healthy life, right? Like if we don't get things on track. So yeah, it's so often the support, you know?
But that's the power of compassion. And that's why that's why I wanted to have you on, because, you know, I don't want our patients to suffer. And as a result of, you know, a lot of us being burned out and what have you. And, you know, if we can prevent, you know, whatever percentage of us going down that road, I think will directly impact patient care. I think that there'll be better outcomes, better results, better experience for our patients. So yeah, like,
and then they're more likely to adhere to advice, like the stories we've talked about, right? Like they are more likely to follow direction. So things like, I don't know, a patient that's just had a heart procedure. I remember hearing these stories at the Heart Institute, and they're prescribed medication like anti-clotting or whatever. People don't stay, if they don't follow advice, it can like reverse everything that's being done. But we know so much of it is the power of, I'm going to be going to see my doctor or my nurse or whoever. And I know they care. I want to have done my homework, right? Like that sense of kind of mutual responsibility.
Mm-hmm. Yeah. And I mean, not to tie everything to COVID, but even when I get a lot of unvaccinated people reach out to me, and I'll tell you, the stuff when they make their decision, I mean, a good percentage of the people will decide to get vaccinated, and it's not. I have a feeling it's not that much based on just the facts. It's the fact that there's someone there that's willing to listen, to hear their concerns, and validate them. Because you know, I believe it or not, some people have like valid concerns when it comes to some of this. Yeah. And you know, and then because of that approach, a lot of people getting vaccinated. And this is why I think, you know, I do want to continue to preach, like, you know, carrot over sticks, because this is where let's establish that trust. Yeah. Like really establish that trust, because that's a long-term game that will benefit things overall. But
I've actually heard a few people say to me that if people they knew with what they see to be valid reasons for exemptions were getting exemptions, like with some of these job mandates, like whether it's pregnancy or they live with an autoimmune illness, I've heard people say, if those people were getting exemptions, then maybe I'd trust the vaccine and the process. But they're actually being, like, I have had a few people share that with me, that's what scares them, is they feel like, well, what you said, like carrot versus stick, right? Mm-hmm. Yeah. So we're taking a very different approach right now to all of this. And it'll be interesting. I hope we have a lot of research over time to see where we land, right?
I think I still think I don't know how many years from now, 5 to 10 years, when we look back, we'll be like, there were so many things we would have approached differently. Yeah. To get us home. But it's a conversation
crazy
for another
time.
day.
That's for sure.
Yeah, for sure. Yeah. So in summary, if I might say so, Michelle, like, take care of ourselves. Reach out for help. We should also mention, reach out for help if you feel like you need it, So I wanted to say with that I think, again, if people are in leadership positions, if, maybe as well, they have a lot of connections in the community and it can feel like it's hard to go to someone for help, but just know that
There are good confidential places. Certainly, I'm happy to connect anyone as much as I can to, a good therapist or whatever kind of support people need. I mean, even probably for some people, it's maybe going to a registered massage therapist to get like support, or going to physio and chatting if you've had an injury that you haven't been taken care of. Like, it's not just about psychology and psychotherapy. But I do think it's so important to emphasize that telling your story matters, because I think for some rational scientific thinkers, they might be like, well, I'm here. I felt relieved when I got my vaccine and I was working frontline, or now it's been 6 months since I got the vaccine and I'm okay. Why now? What good does it do to talk about it? But what we see with, you can have compassion fatigue, and that can start to, blur into trauma. And there's definitely overlap in this situation. A lot of us have different traumas we've been through. But I think that talking it out and telling your stories is what prevents PTSD. Like, it's what prevents disorder and like long-term effects where we don't go back.
So you really like expressing yourself, making sure to not bottle up that shit and find some outlet.
And it could be that you have like a work friend you start going for walks with and both of you talk, but it also could be that you need to be with a professional where it's like a lockbox, a safe space. And I think that so many people are surprised by what a difference it makes just to tell your story. Like, maybe tell your whole story. Go back to the beginning of the pandemic, talk about what it was like for you. And what I often say is then we start connecting the dots. And when that comes out for people, where they start, connecting how they're feeling now to what they've been through, insight can really lead to change. Like, we can see symptoms reduce. Sometimes too, people might need to go the medical route. Like, definitely, I think there's plenty of medication being prescribed during the pandemic for mental health too. That's obviously not my job, but it's good for us to say that's okay. If people need that, that's another tool, but along with therapy and like whoever is a support for you, right?
Yeah. Having that confidant, having that support network, never been a more important time, I would say, for a lot of healthcare providers, Michelle.
Yeah, and kind of like can be a bit humbling, but also a really great experience to be on the other side, right? Like, what's it like to be the one receiving support? That's a really good experience for a lot of people.
Man, like as usual, Michelle Sorensen, knowledge being thrown everywhere. Oh, thank you. Like, honestly, thank you as always for agreeing to do this. I know it's gonna affect a lot of people. I think it'll be influential for a lot of people that I've heard struggled during this time, and we still have it was timestamped. This is October 24th, but we still have quite a ways. Like this virus isn't going anywhere, and I think it's going to have some lasting impact. So whether we're in the throes of it or doing these microwaves, we're going to have to deal with this. So like, I honestly, thank you so much.
Well, and that's part of it, is dealing with all the uncertainty is really hard for people. I think that's where it's the grief and the anger that kicks in about that, right? Like,
if I'm being honest, I think that's a big one too. Like, I think for people that I see, like, you have a couple admissions into the ICU with COVID, unvaccinated, and you're thinking, oh, is this going to be the beginning of more? Like, what is it going to look like a week from now? Is it going to recreate some of the trauma, PTSD that happened in the previous waves?
Yeah.
So I think that's a great point, is the uncertainty.
Yeah. And trying, like, when there's a quieter period or a period where you can create space for healing. For some people that might be going to a cottage, or for other people it might just be like a few extra days off or going to more yoga, like whatever it looks like if you can create more healing, think of that as kind of building up your reservoir again. And I guess the last thing I'd want to say is just if anything you and I have talked about here, like one little worry I have is people might recognize themselves and be like, oh, that's me. I haven't been as compassionate. I haven't been as nice. Like, please don't feel shame. It's just a normal part of, I think this is a huge learning experience for all of us. And I mean, I know for me in my 20 years in mental health, like nothing tested me like, last year. It just was such a different time to be practicing. Mm-hmm. So if people notice they're not themselves, like, please try to, name it. If you feel shame or guilt, you can name it, but then to try and move past that and say, like, there's no need to hang on to it. Anyone in these circumstances would have bad times, Yeah.
And if I've, on a personal note again, like just the thing that's probably helped myself throughout these tough times, not just in pandemic. Well, during the pandemic, not so much the medical side, but just the outside of the hospital walls has been the self-compassion, to be honest with you. Like that, to me, if you could tell yourself, it's okay that for example, the kids have watched 3 hours of TV right now because you're spent. Like it's just to be able to forgive yourself and say, this is okay.
Yeah. We're getting takeout again. So be it. Yeah, exactly. Like that to me has been the one out of all the kind of, things you hear about, the advice, that to me has been the one that's been of such significant help because, it's a lot of us tend to beat ourselves down when we're not performing or at our where we want to be. Yeah, there's such a like, how do I push through versus what do I let go of? And I think, along with the self-compassion is self-appreciation. Like, say someone's had a super hard week or even just a really hard shift and you're driving home from work or you're heading out and, you feel that kind of like you're drained. If people can then think, okay, what did I accomplish today? I did my best. I contributed. And I know, like, it sounds so obvious, but so many of us are really not good at doing that. Like, it really just, truly giving yourself what you'd give to someone else you appreciate. So I think that goes hand in hand. Yo, that's a great point, people. Like all you healthcare providers that are out there, think about what you do on the day-to-day. I was on call a couple weekends ago, and the amount of hustle the group did to try and save a patient that unfortunately passed away. How we came together, it was an emotional loss. The patient was relatively young, but what I was so proud of the group. I was so proud of, we had a problem. We focused. No one was complaining. They just did everything they can to try and get the patient through and be so supportive to the family. It was a negative outcome, but I'm like, afterwards, I'm like, you guys hold your head high. Like the way you did today was unbelievable. Yeah. Unbelievable that you guys can work together like a team. Like, cause the next time somebody comes through that's on the brink, I know that they're in that much better shape because of you guys, because of the work that you've done. And so it's a really good point too, Michelle, is sometimes you gotta, in those times where you get to self-reflect, it's the work that we're all doing is unbelievable. And really remember each other, right? Like we need to do that so much. I mean, leaders need to do it for their mentees and the more junior people, but vice versa. Like for people to say to their manager, like, your support means a lot, thanks for, helping me out with that. I mean, just the more one person does it, the more the other thinks to do it. And the other thing that goes hand in hand with that is people practicing it outside of work, right? Like that's a great way to practice. I mean, people with young kids, you survive the day and you're like, wow, we got groceries done today and we tidied up a bit and the kids played outside, like good for us. And that's something I recommend to a lot of my clients, like try and focus more on what you did. Cause we're just not good at giving ourselves credit. Today, I took my youngest daughter there, Sam, and a friend out to the pumpkin patch. And it was sort of like a goal I had for this weekend. I'm like, it's so nice. We're doing Halloween again this year, right? Like most people pretty much missed it last year. nothing really happened in my neighborhood. So we're, trying to like step it up a bit. But it can be so hard to do those things, right? But we went out and then we ended up going and getting decorations somewhere. And then we decorated the doorstep. And I actually it's good for me. I have to practice it too. Like I said out loud to my husband later, we were going on a walk and I'm like, I'm really glad I made time to do that. Like that was a goal this weekend and I did it and it was fun. And so, yeah, like then when we do that, we can be like, oh, look at me practicing self-appreciation, just build on it.
Yeah, that's going to be one of my other lessons that I take away from this is that self-appreciation and give props when props are due. You know what I'm saying? Yeah,
it's so important.
Every time we leave these conversations, Michelle, I feel that much better about, humanity, because I do think we'll be in a better spot as we progress through this. And once again, people listening, I know this is going to mean a lot to them. So thank you once again, Michelle.
Thank you. I appreciate it. I mean, thank you for bringing so much psychology into your platform and what you do, because I think psychology and medical care just intersect in such an important way. So thank you.
You could blame my wife.
I was gonna say you've got the best in your corner there.
Yeah, absolutely. She every time the problem comes up, have you thought of the psychological component of this? How much anxiety is happening along these lines? Yeah, like it's ingrained. It's going nowhere. But yeah, for sure. Thanks again, Michelle.
Okay, have a good night.
Kwadcast Nation, as per usual, Michelle throwing down knowledge. I hope you guys enjoyed that. Follow us on Instagram, YouTube, Twitter at Kwadcast. Leave any comments at kwadcast99@gmail.com. You know about Solving Wellness, solvingwellness.com. Sign up today as we continue to change that boogie. And don't forget, leave us a 5-star rating wherever you listen to your podcast. Helps with the visibility of the show as we try and change that boogie. Thanks again, everybody. We're going to connect again real soon. Stay safe.